Okay, so now we're going to continue talking about our carbohydrate digestion, and here we're going to talk a little bit about lactose intolerance and what it means. And then we'll also talk about the importance of fiber in our diet and in digestion. So, of course, lactose is a sugar found in milk and milk products. It's a disaccharide that is made up of glucose and galactose. We do have an enzyme called lactase that can break apart glucose and galactose. And of course, that means lactose is a disaccharide, glucose and galactose are monosaccharides, and we can only absorb the monosaccharides. Now, most infants are going to be able to produce a lot of lactase, and therefore they're going to be able to break down milk just fine. When you go into adulthood, and actually between about at the year of 2, you're going to start losing your lactase activity. And often by the age of 5, most people have lost most of their lactase activity. And so this is mostly because the gene that is going to transcribe lactase gets turned off. And then you can no longer digest lactose. Now, lactose intolerance can be associated with symptoms if you take in lactose. So you can have pain, nausea, flatulence after digestion of dietary products. However, there are various degrees of lactose intolerance. Some people can tolerate no milk. Some people can tolerate a cup a day. So it just varies from person to person. But for most of the world's population, levels are less than 10% of what you had as an infant by the age of about 5 to 7. In adults, we have hypolactasia, or adult lactase deficiency, and this is also referred to as lactase non-persistent. So in general, there are 4 types of lactase deficiencies, and 2 of them are associated with genes. The first is primary lactase deficiency, which is going to be inherited, and that is what affects most people, is a loss of lactase over time. The second is secondary lactase deficiency, and this is associated with some sort of injury, some sort of disruption or disease. And once that injury, disruption, or disease is taken away, you can go back to metabolizing lactose. The third is a developmental lactase deficiency, which usually affects premature infants, and usually they get over it over a period of time. And then finally, there's a very rare congenital lactase deficiency, and this is an autosomal recessive inherited pattern, and this is going to cause a lack of lactase production from infancy. Now, there are also going to be certain areas of the world where milk is dependent on more, so Western and Northern Europeans tend to have your lactase persistent phenotype. It is normal for adults to have hypolactasia, and again, congenital lactase deficiency is going to be very rare. Now, when you don't have lactose in your diet, this can affect your health. You still need essential nutrients, especially calcium and vitamin D. Calcium, of course, is going to be important for your signal transduction pathways, releasing neurotransmitters, insulin release, fertilization, muscle contraction. And vitamin D, of course, is going to be necessary for your skeleton, your calcium balance, reabsorption of bone, promoting reabsorption of bone, increasing osteoclast numbers, bone formation, and parathyroid hormone function. So even if you can't drink milk, you still need some your calcium and vitamin D. You need to have that in your diet. So here's just a table from the NIH, which shows what is the recommended daily allowance of calcium. So you can see here that it doesn't really change too much. It's pretty high for your entire life. And surprisingly, people might be surprised, but you only need 700 milligrams a day if you're 1 to 3 years old, and that will increase. The highest is going to be in individuals who are in their adolescence and pregnant and in adolescence. And then there's various degrees in between. So in essence, you still need to take in some form of calcium if it's not in the form of milk. So now let's look at foods that have calcium. So we'll start with talking about milk and milk products. So if you are able to metabolize milk, for example, you can have yogurt, plain milk, skim milk, 1 cup. This is going to have a calcium content of 252 milligrams. And so what this means, and I just averaged, if you need 1,100 milligrams a day, you need to drink 2.4 cups of milk or eat 2.4 cups of yogurt. Now, when you have reduced fat milk, even with added A and D vitamins, this drops to 293. And then you need 3.8 cups in order to get the recommended daily allowance. Swiss cheese is one of the higher cheeses for calcium. You would need to eat 5 ounces of that a day to get your 1,100 milligram per day. Cottage cheese, 5 cups of cottage cheese a day. If you just wanted to binge on ice cream, you need to have 6.5 cups of ice cream a day to have the recommended calcium intake. Now, if you can't metabolize milk products, there are some non-milk products that have calcium, and here's a list of just some common foods. If you love sardines, keep the bones in because that can give you a decent amount of calcium. You only need to eat 3.75 ounce cans of bone-in sardines to get the necessary calcium intake. Rhubarb is very similar to sardines. You need about 3 cups of cooked rhubarb. Soy milk with added vitamin A and vitamin D, you need about 3.7 cups. If you have normal, regular soy milk that does not have the added vitamins, you need to drink 17 cups of that a day to get the recommended calcium, and so on and so forth. So you can see that non-milk products do have calcium, but you need to make sure that you get enough per day because they don't have nearly as much as the milk products. Now I just want to talk about dietary fiber. So dietary fiber are going to be coming from our plant materials, and these are going to be resistant to digestion by our enzymes. This doesn't mean they don't get digested because we have in our gut bacteria, and bacteria can digest these. So some examples of dietary fiber are wax. We have beeswax. Sometimes there's wax on our fruits. We have lignin, which is going to be very high in our strawberries and peaches, for example. Pectin is going to be high in our apples and oranges. And then cellulose is going to be in our grains, for example. Now, cellulose is important. It's thought about 50% of the world's organic carbon source is bound up in cellulose. Plants are everywhere. The nice thing about cellulose for plants, it absorbs and it holds water. So plants are able to use cellulose as a mechanism of keeping water inside of their cells. In addition, in humans, cellulose can do the same thing in our gut. It can absorb and hold water. And this is the quality that helps to promote regularity in our digestive tract. There are going to be soluble fibers. These are referred to as fermentable or prebiotic. Soluble means that they dissolve in water. They are going to sometimes have viscosity associated with this. And when they do have viscosity, this can delay gastric emptying and extends that feeling of fullness. Some examples of viscous fibers are oats, barley, and mushrooms. Some are going to be non-viscous, and some examples of non-viscous are going to be legumes and bananas. These soluble fibers are thought to lower low-density lipoproteins, which are a risk factor for cardiovascular disease. We also have insoluble fibers. These are going to be our wheat bran, our cellulose, and our lignin. When you coarsely ground these insoluble fibers, these cause what's called bulking, and it makes it easier to pass stool. When you finely ground the same insoluble fiber, this has the opposite effect. It causes constipation. So in general, it's thought that we need to take in fiber about 19 to 38 grams a day. This is going to help to lower blood cholesterol. It's been associated with rapid absorption, slowing of absorption of simple sugars to prevent high blood glucose levels. And 10% of our calories come from bacteria. So bacteria that can digest fiber are going to contribute to that 10%. And they're going to break them down into smaller oligosaccharides that we can then absorb.